Non, on est là, mais ils sont tous en... Ah, il y en a qui commencent à se connecter.
On va envoyer les catholiques.
Non. Ils sont tous en mute, qu'est-ce qu'ils foutent? Le professeur Helal, il est là. Il est là. Ah.
Good afternoon, everyone. This is Maha Amin, medical oncology specialist at the Foundation. It's a great pleasure to share you this moment of the third annual webinar of Bahia. Bahia is a multidisciplinary foundation specialized in breast cancer that provides all needed facilities of breast cancer patients through their whole journey from early detection, diagnosis, and treatment. With integration of supportive care, we participated in many international clinical trials, publications, and training programs for the junior staff. We have an interesting topics on today's meeting, hosting 3 expert speakers in breast cancer, with a great honor having Professor Martine Piccart, Professor Amany Helal, and Professor Ahmed Al-Bastawisi. All questions are welcomed at the end of the webinar at the chat window. We will commence with the introduction by Professor Amany Helal, Professor of Medical Oncology, NCI Cairo University, the head of Medical Oncology Department at Bahia Foundation. She participated as a principal investigator and co-investigator in many breast cancer clinical trials with lots of publications. Please keep your attention.
Good afternoon, everyone. Okay. I would like firstly to thank Professor Martine Piccart and Professor Ahmed Al-Bastawisi for joining us today as outstanding speakers. I also would like to thank the attendees, the Roche team, and of course the great team of Bahia for this great opportunity to launch third Bahia webinar. The webinar will focus on the management of the HER2 positive breast cancer. HER2 positive breast cancer represents about 20% of the all breast cancers, and it is known to have an aggressive phenotype until the advent of the trastuzumab, where the natural history of the disease has been markedly improved. Now we have a lot of the HER2 targeted agents with more improvement in the outcome of the treatment of this disease. However, there are many challenges in making standards for the treatment. And in this webinar, we will try to focus on these challenges and trying to find a map for the best treatment options for these patients. Thank you very much, and please keep joining us.
Welcome back again. Our next speaker is a popular figure in the ecology world, Professor Martine Piccart, the scientific director at the Institut Jules Bordet and honorary professor at the University de Bruxelles. Actually, it's a great honor to have her with us today. She's the co-founder of the International Research Group with participation as a principal investigator and co-investigator in many trials that made her own fingerprints in changing the practice of breast cancer management. Today's talk is about progress in HER2 positive breast cancer treatment tailoring who needs less, who needs more. Please welcome Professor Martine Piccart.
Je pense que vous pouvez monter. Oui, mais je peux pas.
Okay, Professor, I can start now.
Yes. Okay. So, dear colleagues, good afternoon, and thank you for the kind invitation to talk about a breast cancer subtype for which we have done tremendous progress in the last 15, 20 years. And my first lecture will be dedicated to progress in early HER2 positive breast cancer. What you can see here are the anti-HER2 drugs that we have been testing in the adjuvant setting. Of course, the very first one, the parent drug trastuzumab, as you know, is a monoclonal antibody directed at domain 4 of the extracellular portion of the HER2 receptor. Then we have a second anti-HER2 monoclonal antibody, pertuzumab, which is directed at domain 2 of this extracellular portion of the HER2 receptor, and this is precisely the dimerization domain. Then we have a very elegant drug, an antibody drug conjugate, TDM1, which combines a very potent cytotoxic drug methansine, an anti-microtubule agent, to trastuzumab. And then we have two small molecule tyrosine kinase inhibitors, which have been tested in early HER2 positive breast cancer, lapatinib, the oldest one, and neratinib, a more recent one. So what we are going to discuss together today is how these drugs have been incorporated in the adjuvant treatment scheme and for which patients they are indicated today. As a matter of fact, if we look back, what we have been doing in the last 20 years is the testing of three strategies. The very first one is referred to as single HER2 blockade, and it is, of course, the addition of trastuzumab to standard chemotherapy. This was, as you know, an incredibly successful investigation, and after that, we decided to move to the testing of dual HER2 blockade. And here we have tested either the association of trastuzumab with a small molecule tyrosine kinase inhibitor or the combination of trastuzumab and pertuzumab. And then more recently, we have tested a third strategy that I like to call the Trojan horse, And this is indeed the incorporation of TDM1 into the early treatment scheme for these women. Let us quickly review the results of these investigations and then discuss what is considered today the best treatment algorithm for women with early HER2 positive breast cancer. And you will see that there have been quite drastic changes in these recommendations in the last 2 years. So very, very quickly, because this is known by most of you, the first generation of trials in early HER2 positive breast cancer. I think the best summary is, of course, the EBCTCG Oxford overview of this first generation of trastuzumab trials. The individual patient data from 7 trials have been collected, representing close to 14,000 women with 2,302 deaths. The median follow-up is 10 years. And what the table very nicely shows is